Welcome back. Our lecture this week has to do with pharmacology related to the gastrointestinal system. Part 1 will deal with hyperacidity and vomiting, and then Part 2 will deal with disorders that have to do with motility in the digestive system. Our objectives for this week are that you should be able to explain some of the causes of peptic ulcer disease and of GERD. I did give you a few articles that you could use to help review for those of you who have not taken human illness and disease at this point, so that you can be up to speed on those disorders. You should be able to explain the ins and outs, mechanism of action, clinical indications, side effects, and examples of H2 receptor antagonists, antacids, proton pump inhibitors, and anti-secretory medications. And then also by the end of this particular part of the lecture, you should be able to identify and explain the actions of drugs that inhibit vomiting. A little bit of a background. Some of you may not have had chemistry for a while, and if you have, then you'll fly through this part pretty quickly. Acids. A lot of what we're going to be talking about in this portion of the lecture deals with acids. So what really is an acid? Let me see our little pH scale on the right, which might be familiar to you. pH of 0 is highly acidic. pH of 14 is highly alkalinic. And basically, acid is the amount of hydrogen ions that are floating around in solution. If you're looking at that scale over there and you see battery acid, pretty strong. Stomach acid ranks right almost to the same point as battery acid. Hydrochloric acid makes up a good portion of stomach acid, and it's real close, or a little between that 1 and 2 range. So that's what we're talking about when we're talking about acid and acid in the stomach particularly, which is going to be a large portion of what we're going to focus on during this portion of the lecture material on the gastrointestinal system. So these acids play a role in a couple of disorders that we're going to talk about. And the first are that of peptic ulcers. So now thinking back to your reading and that exactly, if you recall, what is a peptic ulcer? We would define it as basically open sores that develop on the mucosal lining of the stomach, and you can also see them on the duodenum. And that's because wherever you see a high acid content. And if you recall, the duodenum is that first section of the stomach, or of the small intestine. So until that acid is neutralized, some of it may go and cause ulceration in the first part of the duodenum also. Picture on the left is duodenal ulcer. Picture on the right is a gastric ulcer, or a peptic ulcer, one that is in the stomach. So, what causes these ulcers that occur in the duodenum and the stomach? The most common cause of peptic ulcers is an infection that's caused by a bacterium. It's called Helicobacter pylori, commonly called H. pylori. Recently, clinical research has shown that this H. pylori bacteria is found 100% of the time in patients who have chronic active duodenal ulcers. So years ago, when we used to think other causes were the primary causes of ulcers, it is not the case. This bacteria seems to be the most common cause. Bacteria goes in, invades the lining, and eats away at it. Of course, Some individuals with or without H. pylori do develop ulcers, and frequently it's due because they secrete excess amounts of gastric acid, hyperacidity in the stomach. Others may not produce enough protective mucus or an enzyme that allows them to stop acid secretion. Alcohol, smoking, and increased activity such as stress, which stimulates the vagus nerve, then stimulates secretion of acid. So they increase the amount of acid in the stomach, putting someone at risk for developing an ulcer. And then we have medications, some of which we've already talked about, that are considered to be ulcerogenic, meaning they create ulcers. If you recall, are non-steroidal anti-inflammatories, or NSAIDs, and steroids. Both inhibit mucus and therefore interfere with the normal production of the mucosal lining in the stomach. So these are a number of the common reasons why you would see ulcers going on, again with the number one being the H. pylori bacteria. To manage ulcers, we look at two things. Number one, we want to take care of the source of the irritation, and then we want to alleviate the pain so that we can allow the mucosal source to heal. Occasionally, in some instances, we can get ulcers that get that deep into the tissue that we end up having to do surgery to repair them because of risk for or people are hemorrhaging. Therapy also can involve lifestyle changes. So patients would be encouraged to stop smoking, to avoid caffeine and alcohol, to reduce psychological stress. They should eliminate NSAIDs and steroids from their prescription regime if at all possible. Now, if a patient has H. pylori, then they need to have an antibiotic. We treat a bacteria with an antibiotic, in addition to these other things, conventional things that we talked about doing. The antibiotic, just a single antibiotic is not recommended because there's a high instance of bacterial resistance with this. So usually there are at least 2 antibiotics prescribed to make sure that the H. pylori is completely eradicated. And then finally we will throw in some medications such as our anti-secretory drugs and our antacids. We will go into those particular medications in more depth later on in this lecture. But in the meantime, because the medication management is very close for that of GERD and peptic ulcer disease, I do want to talk a little bit about GERD. So what is it? What specifically is GERD? Well, it's gastroesophageal reflux disease. Stomach, esophagus, reflux. Something coming back. And essentially what happens, the gastric acid washes back. That's known as reflux. And it comes back into the esophagus. When this occurs, that acid then remains in contact with the esophagus. Now the esophagus doesn't have the thick mucosal lining that the stomach does, and as a result you get your symptoms. Characteristic symptom is heartburn. Patients usually describe the heartburn as an irritation or burning in their chest or throat, usually occurring after meals. Explore a little further, they usually will tell you that it gets worse when they lay down. And sometimes they actually can tell you that they can actually, feel the digestive juices like coming up on them. similar to with peptic ulcer disease, um, patients can develop anemia because these ulcers and that can begin to erode away at the esophagus. The acid erodes away and you start to get bleeding. You can also see strictures forming because scar tissue forms in the esophagus in response to the damage. And when that scar tissue forms, it tightens up the esophagus. So you can also see then some subsequent issues with people swallowing after having gastroesophageal reflux disease. What do we do? How do we treat it? Well, very similar. You're going to see it almost going to parallel here what we talked about with peptic ulcer disease. First, the idea is that we suppress the acid, reduce the amount of acid, and alleviate the symptoms. So there are some lifestyle things that we will recommend, such as eating smaller meals, putting less in the stomach at a time to help prevent the reflux. Eliminate certain foods. If people are having an issue with certain foods, we can eliminate them. Some people may have an issue with hot, spicy foods. Caffeine, as we talked about, caffeine can be a trigger. For some people, being overweight, the abdominal contents push up into the esophagus, and so losing weight for some people can make a significant difference and resolve their issue, and they no longer have their heartburn after they lose 20-30 pounds. And if their symptoms are really bothering them at night, because when they're lying down, that acid comes back, we can try elevating the head of the bed. Now, at home, they may not have a bed that comes up really nice like we do in the hospitals, but they can put a couple cement blocks or bricks or something underneath the feet of the bed, or I should say underneath the head of the bed, the feet that are at the head of the bed, and elevate that up a couple inches. And what that does is that just lets gravity work for them and helps keep the abdominal contents from coming down on them or coming up on them. And then in addition, you will see some of our medications that we mentioned with peptic ulcer disease being used. So let's start to talk about those medications now that we have a background on what's happening in these disorders. First, I'm going to talk about the anti-secretory drugs. As we said, one of the goals is to decrease secretion of acid. So we need to talk about some medications that do just that. The first one is out of H2 receptor antagonists. You should be familiar with this because antihistamines. We talked about that. We talked about respiratory. But in that case, we were talking about H1 receptors. There are two types. There's H1 and H2. H1 tended to be present in the respiratory tract. H2 receptors are present in the stomach. And when H2 receptors are stimulated, they release acid into the stomach. So one of the ways that we can treat or decrease the amount of acid in the stomach is to block those receptors. And so what happens is we put something else in place of histamine in the histamine receptor, in the H2 receptor, and voila, we do not trigger the release of acid into the stomach. Common examples of these would be, and you've seen these now over the counter, Antacids and Pepcid. Zantac is another one. Years ago they used to be by prescription, but they've now been approved for over-the-counter use, so people can buy these over the counter. The one thing that I do have to tell you is they need to be taken before someone eats. They need to go in and bind with the receptors so that they block the receptors before they start to secrete the acid. They will help some if someone takes it after they eat, but it's most effective if taken before they eat. So keep that in mind with patient instructions. People tend to go into the store, get some heartburn, they buy these, they pop them, they don't do a lot of good. Best to take them before rather than after. Common side effects of H2 blockers would be headache and constipation. They're the most common things we see with these medications. A second type of anti-secretory drug that we will use is that of a proton pump inhibitor. Now, proton pump inhibitors were discovered in about 1989, so they're a fairly newer drug on the market. And omeprazole, which you might know as Prilosec, was the first one that was approved for usage in the United States. And this class of drug directly inhibits the secretion of hydrochloric acid into the stomach. What happens is they go in and there's an acid pump that occurs in the cell membranes that actually pumps hydrogen acid out, therefore increasing the acidity in the stomach. So it's pumping it out against the normal gradient. Well, what happens is these proton pump inhibitors go in and block the pump. Basically, they shut the pump off. And so as a result, they cannot pump out more hydrogen ions. They can't pump out the hydrogen ions. They decrease the acid in the stomach. Proton pump inhibitors are really good for the use of gastric ulcers, duodenal ulcers, and anywhere where you get that hypersecretory condition going on. And they can be used in combination with the antibiotics to treat the H. pylori infection if that happens to be going on and the primary cause of an ulcer situation. Common examples would be, I already gave you one, Prilosec, Nexium, Prevacid, Acifex, Protonics. They are all forms of proton pump inhibitors. The common side effects we see with these, again, pretty innocuous. We tend to see headache, nausea, and with these we will see diarrhea. So we can see some diarrhea along with these instead of the constipation that comes along with the H2 blockers. Another class of drugs that we will sometimes use as an anti-secretory are that of the anticholinergics. Now, this should be a review for you. We've talked about anticholinergics before. So think about this. What effect do they have on the nervous system? Anticholinergics will depress it. So specifically, they will decrease, we're looking at here what's called the vagus nerve or vagus nerve stimulation. That vagus nerve directly innervates the stomach. When the vagus nerve is stimulated, it stimulates the stomach, and the stomach then being stimulated will increase its secretion of acid. Anticholinergics decrease activity of the vagus nerve. As a result, they decrease activity of the stomach and therefore decrease acid secretion. If you remember before from our previous lectures, Atropine was an example of an anticholinergic. Scopolamine was another example of an anticholinergic. The common side effects with these, if you remember, were that exostomia, the dry mouth, and constipation. So again, because we're decreasing GI motility, we can see some constipation coming about with the use of these medications. So we talked about cutting back the amount of acid that's in the stomach to begin with. But what if the acid's already there? If the acid's already there, then we can work on neutralizing it, which is after the acid appears, how do we decrease the symptoms? And we decrease them with what we call antacids. You may be fairly familiar with antacids. They're used to relieve pain and indigestion that come along with commonly with overeating, hyperacidity, heartburn, GERD, gastritis, and ulcers. Basically what happens is they neutralize the gastric acidity. They react with the hydrochloric acid to form a water and a salt. Remember from chemistry class, that buffering reaction? Since the hydrogen ions are now used to form water, the gastric acid decreases and the pH of the stomach juices increase. When the pH of the stomach content reaches about 4 or 5, pepsin activity is completely inhibited and the mucosal irritation is totally removed. Antacids are those buffers. There's a whole slew of them, as you can see as examples down in the corner here. The one I don't have there is baking soda, sodium bicarbonate, which is a very common one to be used. Now, okay, so antacids. Okay, we buy them over the counter, Pepto-Bismol, pretty innocuous, right? Well, we do have some side effects that we need to be aware of with our antacids. In general, they are pretty much locally acting, but over long-term use, chronic use, we can see some adverse effects occurring from them. Constipation can occur. We can actually end up with hypophosphatemia. That's the ones that have a high aluminum content in them, can cause low amounts of phosphates in the blood. Hypercalcemia, excessive calcium in the blood, and acid rebound. And what acid rebound is that as the pH of the stomach increases, becomes more alkaline, the secretory cells start producing more gastric acid. So they're trying to combat the fact that the pH is being elevated, so they're trying to kick out more acid. So then when someone stops taking the antacid, now they get this overabundance of acid that's kicking out. It's sort of like, if you're pushing against someone's hand, pushing real hard, and then they take their hand away, and your hand goes boom, pushes forward. That's exactly what happens with this. It excessively reacts to acid and produces more acid than what you need, so you end up with feeling even worse than before. The other thing people need to be aware of with antacids is that some medications may not be able to be absorbed in the presence of an acid. One in particular is that of the tetracycline antibiotics. Antacids will bind with the tetracyclines and then they can't be absorbed, so the antibiotic is basically null, ineffective. So it's something that they do have to watch. If you are taking antacid, they need to tell their doctor so that they can be aware of that, and maybe the reason why some of their medications might not be working as well as they should be. The last thing I want to talk about here You're right, kind of related but not, just kind of works out to be in this section, is that of our antiemetics. Emesis is the medical term for vomiting, and I don't know, I guess I kind of think of the acid when I think of vomiting, and so that's why it fits in here. If someone's vomiting, we basically have two systems which we can attack to stop the vomiting. We can either interfere with the receptors in the central nervous system, or we can directly affect the gastrointestinal system. Things in the central nervous system, we've talked about before, like your anticholinergics, it's just scopolamine. We also have Phenergan and Reglan. What they do, again, is they decrease those dopaminergic and cholinergic receptors in the central nervous system, thereby slowing down the action of the nerves, specifically the vagus nerve, which would stimulate the stomach to contract. So we slow down the smooth muscle contractions of the stomach and therefore decrease the vomiting. However, remember, we're talking about something that affects the central nervous system. So as a result, the side effects that we see along with these medications are drowsiness and sedation. So the downside is someone's been vomiting and now they're going to be tired and have those sedative effects. If someone's post-surgical, that's great because now they get rest and they heal until all the anesthesia is out of their system and they no longer get sick. So that's where we most commonly see those type of medications being used, is in our post-procedure clients. Now, the other one is we can try to affect the gastrointestinal system directly and not go through the nervous system. And I gave you two examples of medications here, Nosotrol and Emitrol. Basically what these are is they are carbohydrate solutions. They're combinations of sugars. And you put this high sugar content into the stomach, and the sugar has an effect on the stomach that it decreases muscle contractions. So the smooth muscles relax, and we can cut down emesis. Very effective, for example, in pregnancy, where we wouldn't want to be taking a central nervous system depressant. Goes back to the kind of thought you may remember at some point, a grandmother, an aunt, someone telling you to, when you're feeling sick, to drink a flat soda. Again, it was the high sugar content that you took in that helped relax the stomach. So that's where those two medications kind of come from. Again, they can be purchased over the counter and work pretty good for temporary cessation of vomiting going on. And with that, we end our first lecture on the gastrointestinal system.